So greetings, my name is Gideon Smith, Project Coordinator for the Caribbean Future Forum. Today we are in PAHO at the Port of Spain office discussing good health and well-being, which is SDG number 3 of the newly adopted Sustainable Development Goals. I have the distinct pleasure of discussing this goal in a Caribbean context with Dr. Carissa Etienne, the director of the Pan-American Health Organization, more commonly referred to as PAHO. Dr. Etienne, thank you very much for making the time to be with us here today.
Thank you for having me.
Thank you. And moving right into our first question, can you share with us a bit about Sustainable Development Goal number 3, which speaks to good health and well-being? So how do you see that this goal, along with the other 16 SDGs, can be relevant in responding to the epidemic of chronic NCDs in the Caribbean, and what would be the role of PAHO?
Thank you. Well, you know that the Sustainable Development Goals, that whole agenda is a very ambitious agenda. We fought to have health included in this agenda because we recognize, and subsequently the world recognized, that health was an important input for development. There can be no sustainable development without health. And we wanted health throughout the life course represented, and we wanted universal health coverage represented. And I think it's important that this agenda addresses equity and the eradication of poverty. This also has implications for the work in NCDs, and it also speaks to partnerships and protection of the environment and the climate. And so this SDG 3, which speaks to health and well-being throughout the life course, addresses and speaks of universal health coverage and the need for all people to have access to a basic minimum standard of care, quality care. And it also mentions NCDs, and importantly, it sets a target for NCDs, which is the reduction of premature mortality by 1/3 by 2030, but also has targets for alcohol use and tobacco. Well, as you will know, NCDs are the most important cause of death in the Caribbean, as is for all of Latin America and the Caribbean. In the Caribbean, we have about a 10% prevalence of diabetes. Diabetes is the most important cause of death throughout. Cancer is the #2 cause of death in Trinidad as well. Hypertension is the leading risk factor. And there is a prevalence of hypertension of some 30%. So not only are people dying, but all people are dying at a premature age. So 1/3 of our deaths occurring before 70 years of age. And this is important because it also has implications for productivity and for economic development. But what we are saying is that in the Caribbean, there is not a sufficient response to NCDs. Many of our countries have signed the Framework Convention on Tobacco Control, but they're not enacting the legislations that are necessary. And for those who have, they're not enforcing that legislation. For alcohol use as well, the Caribbean actually is doing very badly in terms of reduction of alcohol use. We see commencement of alcohol drinking in children 13 years of age, and the levels of alcohol consumption are significant. And alcohol consumption is also linked to road safety issues. We see the physical inactivity, although some countries are doing some work with physical inactivity, and also the unhealthy diets. The Caribbean, we eat foods that are high in salt, that are high in sugar, and are high in fats. All of those are bad for our health. And these are very much linked with our socialization. Caribbean people, we celebrate and we live with food and drink. That's how we socialize. And this is so much related to the outcomes that we are seeing. I think it's important also to link it to universal health coverage, which is how do we ensure that all people have access to the social determinants of health, which are also related to them remaining healthy, but how do we ensure that all of them have access to basic preventive, curative, and promotive and rehabilitative healthcare services? Because many of the deaths are related to the complications of diabetes and complications arising out of hypertension. And unless people have access to regular treatment, to regular preventive care, then we are going to continue to see the levels of mortality. And it is important also because the Caribbean is aging, and we are aging at a rapid rate. And with aging also, that is associated with increased levels of non-communicable diseases. So we do have a huge issue in the Caribbean. But we recognize that SDG 3 is linked with many other SDGs, and that's why I spoke about the social determinants of health, and access to water, access to sanitation, access to education. All of those have a direct impact both on NCDs but on general health and well-being.
Thank you very much. And moving into our second question, building off of that, what lessons can be shared with Trinidad and Tobago, and of course by extension the wider Caribbean region, based on your experiences with other countries for addressing the following health and well-being concerns? So one would be the increasing threat of NCDs, such as diabetes, cancer, and high blood pressure, the spread of HIV/AIDS, and also the health burden caused by road traffic deaths and injuries, because that's very, very common in the Caribbean region.
Okay, so what can I suggest based on our experiences? We have evidence that there are countries who enforce alcohol legislation, and through that they've been able to reduce the alcohol content. In 2007, the Caribbean heads of state, they met and they recognized the NCD problem then, and they had a number of recommendations that spoke in part to increasing taxation on alcohol, increasing taxation on tobacco, on unhealthy diets, particularly sugary drinks. We have not seen that materialize. Yet we know that if you enforce legislation, if you create the environment where people are not allowed to drink, where you do not sell alcohol to minors, that this can in fact reduce alcohol intake in the population and have also a positive impact on road safety as well, and on domestic violence and societal violence. We see that, I know that there are countries in the Caribbean, 2 countries, who have increased the tax on sugary beverage. This has also been done in countries like Mexico, and we can see that it is having a positive impact. It had a positive impact in some other countries. We have the case of Ecuador, and Ecuador has introduced innovative food labeling, where every food is labeled for sugar, for fat content, and for salt content. And it's innovative because they do it with red, yellow, and green. And so if it's red, you know that it is high in salt, or high in fat, or high in sugar. And this is having such a positive impact in terms of advocacy and in terms of changing habits, because many children are insisting in their families that their parents don't buy food that have the red indicators, and it is having a positive impact in those countries, to the point where the private sector is coming and saying, okay, we will willingly and voluntarily reduce the salt content or reduce the sugar content. So I believe that is one of the recommendations that we need to take very, very seriously. I think tobacco use as well. I mean, we have children smoking tobacco at a very young age, and we are seeing increasing tobacco use in the Caribbean. And this can be addressed with taxation. It can be addressed with legislation. And we know that those work in many countries who've tried it. So we need to move. You talk about diabetes, so certainly that's the physical inactivity and the reduction of sugary drinks, and we need to stop the advertisement of sweet sugary drinks and alcoholic drinks and tobacco. We have to change the whole way we allow tobacco advertisement to be done in our countries, and we have to target school children with many of those legislations and advocacy. HIV/AIDS, obviously, I think the Caribbean has been having impact in HIV/AIDS. We are on the cusp of eliminating mother-to-child transmission of HIV in many of our countries. They have done the surveillance work that is necessary, and we are awaiting validation, and so this is good. The Caribbean has to ensure that the supply of ARVs is kept up for all persons suffering from HIV, because we have the objective of that all persons who are HIV positive receive medication. And so, but I think the Caribbean is advancing as far as that is concerned. Obviously we will face a challenge because the international aid for HIV is being reduced drastically, particularly in the Caribbean region, and therefore governments will have to make a decision for investments around HIV. What was the other topics again?
So it was HIV/AIDS, the road traffic deaths, as well as the NCDs, diabetes, cancer.
Road traffic accidents. Road traffic accidents really have very little to do with health. They have everything to do with your construction of roads and highways. They have everything to do with safety barriers and rails on your highways. They have everything to do with enforcing the traffic laws and ensuring that you target drivers for drunk driving. So all of these are really outside of the purview of health. What we do is we see the results of the failure of this road traffic safety. But the primary responsibility is an all-of-government approach. If we have a good screening program for cervical cancer, we can identify the changes early and we can give treatment, and the majority of these women will be saved. The same thing for breast cancer. We need to teach women to do their self-examinations, and we have to increase access to mammography services. Our patients, our women are coming to care when these cancers are too far advanced. The same thing for men and prostate cancer. We need to ensure that all men have access to prostate cancer screening, and that we make an effort to ensure that men come. Because in our Caribbean region, men do not present for preventive care. And we need to work with our males so they recognize that preventive care is important for them. Colorectal cancer is the third highest cause of cancer deaths in Trinidad and many of the Caribbean regions. And this also is amenable to basic healthcare screening of doing stool examinations for blood, of regular colorectal examinations. So there are things that can be done, but that requires a well-distributed, well-trained healthcare workers with facilities that allow easy access to the population for those screening services and for care and treatment of those cancers.
Okay, thank you very much, Dr. Etienne, for your time, and of course those comprehensive responses and suggestions that should most definitely be incorporated into the health systems of the Caribbean region. I particularly liked your point on there can be no sustainable development without health, because of course, as important as it is to move toward a sustainably developed Caribbean, it's equally important to have the healthy individuals that can enjoy it. So thank you very much, and I do hope that your visit to Trinidad and Tobago has and will continue to be a very successful one.
Thank you very much. And just to reiterate that health is an investment for development. It contributes to productivity, it contributes to the economy, and it contributes to well-being. Thank you very much.
Thank you.